Carboxy therapy has been used in Europe and South America for over 85 years. It is proven to increase microcirculation, speed up healing, and increase hydration in the skin. There are many articles that have been written and published in medical journals that show the efficacy of carboxy therapy in the treatment of wound healing and skin rejuvenation. This is why CO2Lift Pro Carboxy Gel, the transdermal carboxy therapy, is ideal for post-care after laser or other types of invasive procedures.
I'm so excited to be part of the team to bring CO2Lift Gel Carboxy to the attention of providers all throughout the United States, because this product is simply a new twist on old technology. You see, carboxy therapy is over 85 years old, and typically it has been applied through the use of subcutaneous injections. So now to have an application, and the only proven application that's applied transdermally, it is exciting. And I think the more that providers understand the benefit of carboxy therapy and how versatile it is through the skin with no pain involved, I think they will see that it should be the staple in their office.
I have used it after laser treatments, after IPL. I've used it after microneedling. It's great with microneedling because with the microneedling, it really lets the product go even a little further. The same with microdermabrasion. You can imagine with little channels what this product can do.
I use CO2Lift after ablative procedures such as ablative laser treatments. Examples are Fraxel laser, or in my case, pixel laser, chemical peels, so some of the mid-level or the mid-depth or deeper chemical peels, skin surgeries such as liposuction, skin tightening, skin excisions, and so on. It's very safe to use it, so I often send my patients home with CO2Lift. The trick behind it is to mix it until the consistency has turned a little pink and also a little stickier. And then also you want to apply a generous amount to the skin and leave it on for at least 45 minutes. In this video, I'm applying CO2Lift to the skin after an ablative laser treatment. The CO2Lift actually helps to relieve some of the discomfort that patients experience after they have the laser treatment. So what we're doing with CO2Lift is we're changing the skin chemistry by using carbon dioxide, and we're kind of making carbon dioxide available to the skin for about 45 to 60 minutes. The treatment, CO2Lift, is very safe. So I actually put it all the way to the eyelid, and it's not toxic at all. So if you get anything into your mouth, you don't have to worry. And it's very easy to apply. It's something you can do every day if you want, but I usually recommend 3 treatments, usually 2 to 3 days apart.
The CO2Lift Pro Carboxy Gel is a staple product of any provider because of its wide indications of uses as a standalone in anti-aging with no downtime, no pain, and immediate results, or in combination with other procedures like microneedling, chemical peels, or laser to enhance the results and reduce recovery time.
What an ideal setting, rather than the standard dressings which are messy and oily and ooze. This is a simple mask that's put on their skin and makes them heal quicker, they have less redness, and they get the added benefit of healthier skin.
The CO2Lift Pro Carboxy Gel is simple to apply, whether it is done in the office or is sold for clients to take home. Also, patients will benefit by using the CO2Lift Pro Carboxy Gel versus other petroleum products.
Many of the patients that we treat with some of the more aggressive lasers, we use Aquaphor or Vaseline on them, and people get very annoyed because it's messy, it's oily, and even in warmer climates, it's really a problem because it's humid. One of the great things about the CO2Lift Pro mask is that it actually hydrates the skin. So in colder environments, and we're in New York right now, where the winter is cold, it's terrific because it provides moisture to the skin, so the skin doesn't dry out, and yet in warmer climates, it's not oily and messy, like Aquaphor or Vaseline. So it can be used really anywhere without any problems at all.
We just finished a nice BBL halo, medium to high grade halo treatment for her. How are you feeling right now, Shannon?
My face is pretty much burning.
Pretty much burning.
Yeah, it's on fire.
So what we would typically do, or often do after a halo treatment, is apply some ice to the face to help cool down the face rather rapidly to help comfort the patient. However, there's a great new product that has been out and in the US for a while, the CO2Lift Pro. Okay, what this is it uses Carboxy technology to hydrate the skin. Has been shown to hydrate the skin up to 117% after a treatment. So after we just use this fairly aggressive laser procedure for the patient, it's a very nice treatment to put on as a mask. So this is applied immediately afterwards, and then we're able to, with the CO2Lift Pro, send the patient home with a treatment for the day after, 5 days after, and then usually 10 days after. And it helps decrease redness, inflammation, helps hydrate the skin, helps tone, decrease pore size, all the things that we're still trying to do with the laser. So it's an added benefit.
The amount of redness and inflammation is significantly less, and your forehead is barely, looks like you spent a couple 15, 20 minutes outside in the sun.
Okay.
Cheeks are red,
Right.
But the forehead, which we treated first, I mean, it's almost back to your normal skin.
No,
color
and it
already.
doesn't feel like now
Dry.
that it doesn't feel dry, and it doesn't feel like it's burning anymore. It's just like a tingle, kind of like I'm sunburned.
Yeah.
The initial cost to get started is low, and the price for your patients is affordable.
One of the issues that arises with plenty of patients is the issue of cost. They're already paying for a laser procedure if they're doing this with the laser procedure, and they want to know how much more is this going to cost. And the reality is it's not expensive. Fees can vary, but it could be anywhere from $80 to $150 depending where in the country. But for many patients who get high-end masks from department stores, they actually pay more money than that. So we have not had a problem with that at all.
It's affordable. It's a low cost to get started with CO2Lift line. And so the provider can bring it into their office at a low carrying cost, and yet the return is there. The patients are going to love it, and it's going to become a real profit center in your office.
CO2Lift Pro, the Carboxy gel mask, is a must-have for any provider looking to provide the latest in technology and increase revenue to their practice. For more information or to receive a free sample, visit www.lumisque.com and email support@lumisque.com.